So, welcome to Dental Campus. Dear friends, dear colleagues, welcome to the module about communication with the patient. This is going to be a slightly different module because we're going to start, of course, from the clinical application and our day-to-day implant dentistry, but we will extend quite a lot to some other areas not directly relevant to dentistry. And we will discuss a little bit within psychology, within behavioral science, and within some other areas of interest that will help us perform the task of communication better with our patient, and also will result to a happier and a more satisfied patient from the outcome of our treatment. So we will move from the very beginning, from the patient's expectations when he is coming to our doorstep, to the very end, the moment the patient walks out fully satisfied with a full implant rehabilitation. And this is quite a long journey, and sometimes it starts much earlier than we actually think. So in the first lesson of our 3 that we will have in this module, we will discuss a little bit about things that take place long before the patient sits in our chair, but will definitely affect the outcome of our treatment in ways that sometimes we do not foresee. And we will talk a little bit about success and how do we define success from our point of view, but mainly from the patient's perspective. Then we will talk about the different parameters and the different factors which determine the satisfaction that the patient will have out of a treatment he receives. And we will also put in place and in context the role of the dentist in order to achieve this patient satisfaction and assess all these parameters. So success, as with everything else, is a matter of definition. And depending on how we define it, we might have an easier or a more difficult way to approach it. And as dentists, we are very detailed when we define success. Especially in implant dentistry, in the last decades we have evolved very specific parameters about defining success. And we're mainly trying to achieve and maintain tissue integration, which we control with radiographic indicators. We want to achieve tissue health, which we control with clinical examination of the soft tissues. We also want to achieve a satisfactory function, which can be controlled through the occlusion, through the chewing ability or phonetics. And of course, we aim to achieve highly standards of aesthetics, which might look natural and achieve natural emergence profiles, papilla index, or even more complex tools for assessing the aesthetics. However, these detailed outcomes are only from our point of view. Our patients, they have no real ways or maybe no real interest to define exactly success the same way we do. So in the last few years there is an increasing volume of research about how patients define success and what do they use to decide between a successful outcome and a less successful outcome. And that focuses mainly on the improvement they perceive in their quality of life and also the patient's satisfaction with the outcome of the treatment. Now, success, of course, is not only a one-shot achievement. It has to be predictable and it has to be also sustainable. And these parameters will have to follow every successful outcome. And when it comes to patient satisfaction and how they define satisfaction, then this probably goes well beyond our clinical outcomes, and it touches the wider sphere of psychology or behavioral science. In order to illustrate to you a little bit about wider research on satisfaction, I would like to bring some experiments, some very interesting experiments which took place in spheres totally different than dentistry. So let's forget for a while that we're talking about teeth, about implants, or about dentistry, and let's move to a totally different domain. And we will start with the Olympic Games. The Olympic Games is, of course, a very big source of disappointment or satisfaction, sports in general. And this is, of course, one very convenient place to research about satisfaction. This experiment that we are reporting right now took place in Barcelona in the Olympics of 1994. And the researchers, they actually developed an instrument to evaluate the satisfaction from the athletes who actually won Olympic medals. So in a sense, what they did, they took all the Olympic medalists, some 700-800 of them, and they tried to find who among them is the most satisfied and the least satisfied with their achievement. And they focused on gold, silver, and bronze medal. So who do you think will be the most satisfied of all these three levels of winners? And the results were somehow surprising. Of course, the gold medal winners were quite satisfied, but what was consistently found was that the bronze medal winners were consistently more satisfied and happier than the silver medal winners in their sport. And in our simplistic mind, this might sound curious. Why, when you get third, you're happier than the guy who came second? But for the researchers of this experiment, this was quite expected. And they attributed this to a very well-known psychological effect, which is called counterfactual thinking. That means that very often our satisfaction and our emotions are not mainly determined by the outcome of the process, but by our thoughts of what might have been. What would be the plan B or the alternative scenario? In that sense, the plan B or the alternative scenario for the bronze medal winners was that they actually made it to the podium. If they had been on the fourth place, they would be had no medal and soon forgotten. On the other hand, the silver medal winners, they were dominated by the thought that they just lost the gold. So the disappointment of losing the gold was weighting heavier than actually the satisfaction of getting the silver, and in some cases this manifested as people who were actually worse off, they were more happy than those who were better off. Now, this is a very, very widespread behavioral phenomenon, and of course it could also affect dentistry. In implant dentistry we might very often see it, and also in general dentistry with people who actually have much better conditions. Nevertheless, they might be more disappointed at their oral conditions. This is an experiment that took place in the dental world, and that was a self-assessment of the oral conditions of patients and an objective evaluation by the dentist. And what they found was that approximately 10% of all these people who were having good or who were having favorable oral health outcomes judged by the dentist, they seem to be dissatisfied with the oral condition. But the second one, 50% of those with unfavorable oral health, as objectively defined, were actually satisfied with their condition. So sometimes satisfaction with your oral condition or with the outcome of a treatment might be affected by other factors than the condition or the treatment itself. In implants, you might see it very frequently when you have an edentulous patient who is getting an overdenture on 2 implants. He might be much more satisfied and much more easier satisfied and achieve much higher scales in the quality of life outcomes than actually someone who only misses 1 single tooth through an accident and has to be replaced with 1 implant. The first one is actually comparing the situation with having no teeth at all, and the first one is comparing it with when he had his intact dentition with all his teeth in present. So let's remember this and move on to some more experiments from the sphere of psychology that might have something to tell us about how patients determine the satisfaction they get from a treatment. This time it is not about Olympic athletes, this time it is about married men. So this experiment was quite funny. They took a large group of married men and they divided them into groups. They locked them in 2 rooms and they started projecting for 1 hour full-on pictures to them. The first group was watching pictures of attractive, inviting, smiling women. The second group was watching pictures of uninviting, angry, annoyed or not good-looking women. And then in the end, they gave them a questionnaire, which among many other questions included the question, how satisfied you are with your wife. Now, of course, this sounds very bizarre. Would you expect that there would be any different opinions between the groups? But apparently there was a significant difference. Those married men who were watching the uninviting and not good-looking women were apparently much more satisfied with their wives than the other group who was watching the attractive women. And you might think that, does this make any sense? Well, apparently this also, according to the researchers, makes sense. It doesn't really have to do with their women. Their women are out of the picture. It's just that they have been brainwashed, so temporarily, for this hour, they mess their brain with the perceived availability of choices. This is another psychological phenomenon, which actually means that depending on what is in your mind, the available choices, this will influence the satisfaction you actually have from the current situation that you face. So when you think that there is so much better out there than what you currently have, then you tend to be less satisfied with the actual thing you have, although this might be a treatment or a possession or whatever, actually will have the same value as it was before. Now, would this affect our treatments? I think yes, here again, we would see this very frequently. You can see this denture that we have here. Would you ever consider to place a denture like that to any of your patients? Personally, I think I wouldn't even think about it. But nevertheless, this was serving in the mouth of a patient, and actually this patient was a very high-profile celebrity. He was the President of the United States a couple of 100 years ago. So back at that time, this was perceived as the cutting-edge state-of-the-art replacement of teeth. And therefore, people were not only eager, but even satisfied and happy to have it in their mouths. So apparently, either you can give your patients the cutting-edge state-of-the-art treatment, or you have to convince them that you give them the cutting-edge state-of-the-art treatment. Ideally, you have to do both. But that means that sometimes what they get and what they think they get might be two different things, and depending on one and the other, this might affect their satisfaction. Now, going back a little bit to the discussion of dentures, research has shown that implant-borne dentures can significantly increase the quality of life in fully dentulous patients. So if we base our opinion on these results, we have to conclude that the best treatment we can give for edentulous patients is actually implant-borne over dentures. But let's see another interesting experiment that took place this time within a dental school. So here we had a randomization. There was a large group of edentulous patients, and they all showed up to get replacement of their missing teeth. And the deal was that they will get the treatment for free, but they will not be able to choose. They just have to state what they want. Do they want implant fixed reconstructions or implant-borne reconstructions, or do they want full conventional dentures? And then there will be a randomization, and they will get the treatment that they will be randomly assigned to. So there were three different groups in this particular research. There was those who requested implants and they got implants. There was those who requested dentures and they got dentures. And there was the third one, those unfortunate who requested implants, but they were randomized to get dentures. The fourth group was a control group with other patients of the clinic, so that they control for any effects of the clinic into the satisfaction or the happiness of the patients after the treatment. So who do you think of these three groups, A, B, and C, was actually the happiest or the most satisfied from their treatment? Well, the first group, those who requested implants and got implants, they were very satisfied with the outcome of their treatment. The second group, those who requested dentures and they got dentures, they were also satisfied as likely as well from the outcome of their treatment. And the third group, those who requested implants but they got dentures, these were the only group that was actually not satisfied with the outcome of their treatment. So what do we see here? There is a very interesting phenomenon. That means that we have group B who gets dentures and they're very satisfied with the outcome of the treatment, and we have group C who also gets dentures, but they're not satisfied from the outcome of the treatment. So, do dentures work to keep patients happy or not? And I think on the basis of this study, we can actually understand that whether dentures work or not objectively, they can achieve to satisfy the patients only if they meet their expectations. Because if the patients were expecting something else, then suddenly dentures will not satisfy them, even if they work in the same way in both groups. So I think we can close a little bit the discussion and start rounding up. So it is not only the treatment that we offer our patients that will keep them satisfied or not. Many psychological phenomena, but also other observations have been brought up in the literature which indicate that if you want to have a happy patient, your treatment is not the only parameter that will achieve it. In another questionnaire study that was done in Finland, they found that personality traits are also very important. One of the most significant personality traits that they have found was what we call sense of coherence. This is a personality trait which identifies individuals who can actually have the ability to cope with unexpected problems to a higher level, to cope with stress, and to possess the motivation to actually contemplate for stressful or unpredictable events. This is piled into a personality trait that is expressed as sense of coherence. And of course, they have found that those who have a high sense of coherence, they tend to be much higher scoring into the health-related quality of life questionnaires, regardless of what their actual oral health status is. So sometimes the personality might predispose people to be more satisfied or to be less satisfied with whatever the oral health condition is. Furthermore, other personality traits that have been identified is neuroticism. Patients who appear to have neurotic behaviors, they tend to be much more negatively predisposed towards high scores in the oral health quality of life questionnaires. And finally, other studies have also identified ethnicity and being foreign born as a fact that actually changes the way that satisfaction is expressed among patients from treatments. So, very briefly rounding up this discussion and having just indicated a few areas where psychology can actually point out the essence of how a satisfied patient is created, I think we have to complete the picture. Usually, we tend to believe traditionally that the patient's complaint is what we have to focus. We will direct our well-designed and well-executed treatment intervention, and that should be enough to resolve the problem and result in a successful outcome. But having seen a little bit wider the picture, I think we have to supplement it. We have to also identify the expectations of the patient. Together with our intervention, we have to also account for different psychological effects, for psychosocial effect, such as the perceived availability of choices, the sense of coherence, some socioeconomic and demographic factors, and personality traits. And together with our well-designed and well-executed treatment, these facts will result into the patient satisfaction. And these two are actually the success outcomes that we are aiming today. We're aiming to, on one side, clinical successful items, the way that we measure them and the way that we have learned to document them, but we also aim to achieve the patient satisfaction from the treatment, which will complete the picture and will make our treatment a clinical success, which will be sustainable and which will be predictable. So to conclude, I think we always have to have in mind that the patient satisfaction with the treatment is not only depending on our treatment, our skills, and our intervention. The second is that the expectations of the patients, which might be visible or invisible, and also some psychosocial background factors from the patient, might very significantly affect the satisfaction that the patient will have out of our treatment. And finally, that calls for a complete assessment. That means together with all the biological, systemic, and local tissue parameters that we will assess before we plan our treatment, we will have to assess also the psychosocial and psychological profile of the patient. We will have to identify his expectations and put everything into a correct treatment plan, which will be complete and holistic. And how we will assess these expectations and what are the implications for our treatment, this is what we will discuss in the next couple of lessons. Thank you very much.